Non-operatively, they do the RICE treatment, rest, ice, compression, elevation. They use non-steroidal anti-inflammatory drugs, put them in a walking boot, short cast for a little while, and they can walk on it because they're not pushing off the toe. They return to competition with little or no loss of time. We had one guy last year with pretty bad turf toe. He didn't miss any time because of his turf toe. We treated it. He got an orthotic in his shoe. We're going to talk about that. An orthotic in his cleat, and we also fabricated a like a hard plastic shell to go around the outside of his cleat for his toe, just to protect us. Nobody kicks him, and it doesn't get worse. And he was okay with that. Sometimes they tape them into slightly down, just to alleviate pressure on that under joint there. Like I said, they should make shoe modifications. They stiffen the sole, and they use what's called a turf toe plate. So it almost looks like an orthotic, but it actually extends further out under the big toe to stiffen their big toe up. And they can play within 3 to 5 days.
Was he able to perform at the same level?
Yeah, he had bigger problems in his toe. Yeah, he had much bigger problems. But yeah, no, it didn't. The toe didn't slow him down. Let's put it that way. We just treated it with tons of modalities and stuff, and actually got better. And he was able to play the rest of the season because that happened in the first third of the season. So it didn't really slow him down after that.
Was it a skilled player?
Yeah. Yep. So if it's non-operative, but it's a grade 2, it's no longer just a slight sprain where it's a rupture. It's going to be at least 2 weeks out from the sport. You start doing some stretching, some range of motion within 3 to 5 days if the symptoms aren't too bad. You can start taping and allowing low impact exercises, but nothing where there's any kind of push off required where it's explosive. Grade 3 for non-operative as well, if you're not going to do surgery, may require up to 8 weeks. It's a longer immobilization. They stay in the boot a little bit longer. They have to have about 50 or 60 degrees of extension in their toe before you start doing any running or explosive pushing off, because you need that much motion to get your foot into that position. Could be up to 6 months before any taping or orthotics are not needed anymore after that. Now this is obviously for somebody who's does not need to get back to playing that fast. If they need to get back to playing, they just fix it. They just do surgery. Some of the indications for surgical treatment is if you have a large avulsion, if it's really separated, like on that x-ray I showed you, if things are really separated, the diastasis, or if there's a fracture, if those sesamoid bones I showed you on the x-ray, those 2 little bones were retracted really far, you have to have surgery to fixate everything. If there's anything loose that's floating around in there, like loose cartilage or anything like that, again, got to have surgery. And if you failed any conservative treatment, you got to do it. So the goal of the surgery is to stabilize the joint and take any extra fragments out and repair the plate of where all those ligaments attach to. Again, and fix any disruption of the soft tissue that's suture. They suture it to one another. You don't need to know the details of the surgeries there. Again, just details of the surgery. Some of the complications that we see after a surgery like this, infection obviously is always a concern after any type of surgery. The wound doesn't heal as well. It's your foot, so feet sweat. They're not good surgical sites, so you got to keep them really clean, keep it dry. Sometimes patients aren't really good about that. DVT, like a deep vein thrombosis, like a blood clot, is always a risk after surgery. Sometimes the nerve gets irritated into the bottom of the foot, and they end up with numbness, tingling, burning, sometimes like that temporarily. CRIPS is a complex regional pain syndrome. It's a syndrome that occurs because of the nerve injury. And there's a failure of the repair. Sometimes the repairs don't take, they re-tear. So that again becomes a big problem because now you're trying to repair tissue that's already been torn twice. So that's an issue for the surgeon, but that's the surgeon's problem, not mine. So post-operatively, you want to balance soft tissue management and mobilization. You're allowed to move it right away. At least we're allowed to move it in the office. Got to have a lot of communication between the physician and the ATCs, PTs, and the trainers. They're putting a splint with 5 to 10 degrees of extension just so it doesn't heal in a contracted position. So if you're repairing something here and you leave it like this for 3 weeks, when you go to stretch it this way, it's not going to move because everything's healed in a shortened way. So they actually they put a splint to put it in slight extension, so as it heals, it stays elongated and it's easier to get the range of motion back later. Turf toe, non-weight bearing for 4 weeks, and a removable splint. They can take it off at night. They have a correction where it actually pushes the toe over a little bit to keep it separated. Range of motion can start within a week after surgery, just avoiding too much coming up. Weight bearing 4 weeks. Discontinue use of the boot at 8 weeks. Increased activities is tolerated with protective tapering or footwear. Very similar to the other surgery. You can start progressing to light jogging, straight line running when pain-free without any compensation in their gait. Straight sprinting, obviously, you want to do before they start any jumping, just a progression of forces. Full contact sports by 16 weeks, but it could take 6 to 12 months for full recovery. So if you have a professional athlete that has this kind of surgery, they're probably going to be playing within 8 or 10 weeks, I would say, with all that protective stuff in their cleat. But they're not really going to be fully healed for about 6 months to a year. But that won't stop them from playing. Working knowledge, so I just need to know the anatomy and therapeutic exercise.